Hello everyone, nice to meet you here. Today I want to share with you a very common heart problem which is called the coronary artery disease. Coronary artery disease, the short term is CAD. It is a very common problem among elderly people above 60 or 70 years of age, especially for those patients who have other underlying chronic problems such as diabetes. So coronary artery disease, remember, it is common among older people. And for the people who have obesity and diabetes, it is even more common. So what is coronary artery disease? Coronary arteries are the arteries that stay on our heart muscle, Okay, so first understand how the heart works. So our heart is like a pump which constantly contract and pump blood, which carries oxygen to the rest of our body parts to supply oxygen and blood and nutrients to rest of our body. So remember, our heart is a pump that continuously contract to supply blood which carries oxygen and nutrients to rest of your body parts and your tissues, your organs to make them survive. So the heart muscle helps your heart to contract. So remember, the heart is made of muscle, which is called cardiac muscle. Heart muscle is so important. It helps the heart to contract and supply the blood and oxygen to the other parts of the body. Okay, so without the heart muscle, the heart cannot pump. Now, coronary artery is artery that stays on your heart muscle that supply blood and oxygen to the heart muscle to provide energy to your heart muscle so the heart muscle can contract. So remember, coronary artery is so important. It provides energy. It supplies blood, oxygen, and nutrients to the heart muscle to make the heart muscle to pump. Okay? But if the coronary artery is blocked, and there is not enough blood supplied to the heart muscle could not get enough oxygen and the heart muscle could be damaged. So we call this condition is coronary artery disease, CAD. Okay, so think of now what things could block the coronary artery. Now there's one very important substance that could block coronary artery, which is called the cholesterol. Okay, so you probably heard of, people go to the doctor and get a blood test and doctor tell them, okay, your cholesterol is a bit high and you have a risk of heart problems. So we know that cholesterol is very important for our heart. Okay, very important substance that indicate our heart health. Okay, so how cholesterol work? Now, not all the cholesterol, they are bad. Okay, there are mainly two cholesterols. One cholesterol is called a high density cholesterol, which is called the good cholesterol. So remember, higher, stand on higher, it's good. Okay. Another cholesterol is called the low density cholesterol, which is a bad cholesterol. So remember, low density cholesterol, lower quality. We don't want it. So it's bad cholesterol. We don't want it. Okay. So low density cholesterol, how bad it is? Low density cholesterol, it could form the plaque. Okay, if it stays in the blood, okay, accumulated more and more in the blood, it could form a plaque, and the plaque could stick onto your artery wall and block the artery. So same with your coronary artery. Okay, if there are more cholesterol, the low density cholesterol could accumulate more and more and then stick onto your coronary artery wall and make the coronary artery become narrow, so more and more narrowed. Okay, with years and years cholesterol, high cholesterol, the cholesterol will build more and more plaque and block more and more of your coronary artery and make the coronary artery finally become fully blocked, and then the heart muscle become damaged. So coronary artery, we know that coronary artery disease is a long-term problem, could last for years, 5 years, 10 years, okay? So, but the coronary artery becomes slowly blocked until at the end it's fully blocked, Okay, and then patient, when it's blocked more and more, there will be less and less blood supply to the heart muscle. So patient will experience the chest pain. So when it blocks more and more and less and blood supply to the heart, we call it ischemic heart problem. So lack of blood supply to your heart muscle, and patient will feel really painful on their chest. Okay, so this chest pain, we call it angina. Angina is a very severe chest pain, and patients normally describe it like very heavy chest, okay, heaviness, crushing pain, okay, and sharp, very sharp pain. And it doesn't get better, it deteriorates with time. And the chest pain, some people even describe it like an elephant standing on their chest. And the pain sometimes doesn't localize in only the center chest, it also radiates. Normally radiates to your jaw, to your shoulder, to your arm, or even to your back. Okay, so a typical signs and symptom is heaviness on the chest and radiating pain. Also, patient could feel very short of breath, so they're struggling with breathing and also feel very anxious, stressful, and have the pending doom, feeling they will die. So all these symptoms indicate your heart lack of oxygen. Your heart is making alert, making alarm. So what we should do to, when you have chest pain, what we should immediately have. So remember one medicine, okay, that could quickly resolve the chest pain is called the GTN, triglyceride nitrate, okay? Triglycerol nitrate. GTN is a puff that spray under your tongue. So you normally give two spray under the tongue when patient have severe angina, chest pain, okay? And it can quickly dilate your coronary artery, dilate the coronary artery wall, and ease the blood flow to the heart muscle, ease the blood flow and make more oxygen flow to the heart muscle, okay, to make it contract again. So remember, GTN, glycerol trinitrate, is a common medication we use as a spray under the tongue to relieve the chest pain in an urgent case. Now, if we don't treat chest pain, what can happen? So if we don't treat chest pain, let it keep going on, patient will have heart attack. So heart attack, we call it myocardial infarction. It's an emergency. It is very urgent condition. Now, heart attack means the coronary artery become fully blocked. There's not any blood supply to the heart muscle, and heart muscle become fully damaged, and there's very less chance of survival. Okay, so when patient have a heart attack, patient will lose consciousness. Okay, and you will need to quickly call 000, call ambulance to save patient's life. And if necessary, you have to give CPR, chest compression. So again, let's make a conclusion, okay? So what is coronary artery disease? Coronary artery disease, CAD, is a disease that the coronary artery, stay on your heart muscle, is blocked by the low density cholesterol. And then there's not enough blood supply to the heart muscle. The heart muscle cannot work, and heart muscle would get damaged. And patient could have symptoms of like severe chest pain, normally described like heaviness, crushing pain, and radiating to the jaw, to the shoulder, to the back. And patient feels short of breath and very stressful and anxious. So when patient have angina pain, you should also give some treatments. For example, give GTN spray under the tongue. Give 2 spray under the tongue to quickly dilate the coronary artery. And also remember to stop all the physical activity, because any physical activity could pose pressure on your heart, make your heart lack more blood and more oxygen. So really stop all the activity immediately. Let patient to comfortably lie down on the bed and stop all the work. Okay, stop all the physical activity. And if patient have heart attack, definitely call 000 and prepare for CPR. So remember, cholesterol, bad cholesterol is called a low density cholesterol that could build plaque and block your coronary artery. So what should we do to prevent cholesterol to be built up in your blood? Now we need to restrict the fatty food, especially the fatty animal meats. So the fatty animal products, okay, contains more fat that we should restrict. So normally animal products contain more bad cholesterol, low density cholesterol. So we should eat more, consume more plant-based foods, vegetables, fruits, and plant-based oil. Okay, we need to use olive oil, vegetable oil, but don't use animal, don't eat too much animal meats. Okay, and also maintain good amount of light exercises, light exercise, and avoid stress, because stress could also trigger heart problems. Stress could also be harmful for your blood vessel and make it narrow, okay, and not good for your heart health. So remember, three things are most important. One is keep a good diet, low in fat, okay, and high in fiber, and consume more vegetables. Okay, second one is maintain good amount of exercise, and third one is make sure you keep relaxed and not having too much stress. Okay, because stress and anxiety, they are very harmful for your heart. Okay, so I hope now everyone could have a little bit understanding about coronary artery disease. Thank you, everyone.